Do you ever catch yourself hunched over your phone or laptop or staring intensely at your computer screen and then notice that dull ache or stiffness creeping into your neck and the back of your shoulders? Yep, me too. And it's an increasingly common problem that I see in clinic. It's been called various names over the years, like postural neck pain, myofascial or muscular neck pain, and forward head positional pain. But more recently, it's adopted a new name that has begun to stick with the general population: Teck Neck. I'm Stephen Bunting, and I'm a specialist MSK physiotherapist working in the UK. And in today's video, I'll be breaking down exactly what Teck Neck is, why it happens, and most importantly, what you can do to get it better. I'll also show you some simple exercises and posture strategies that you can start using right away. So by the end of this video, you'll have a clear understanding of this modern problem and the tools you need to keep your neck feeling flexible, resilient, and pain-free. So as I briefly mentioned in the introduction, Teck Neck is a recently adopted, friendly and easy to remember term for a problem that's been around for decades, but has gotten a lot more common since the age of the smartphone and the modern office. It essentially refers to the strain and discomfort felt in the neck and the shoulders caused by the prolonged poor neck postures that we adopt when looking at our screens. Our heads weigh about 11 pounds or 5 kilograms. In a neutral position with your head balanced perfectly on your neck, there's no muscle activity involved in keeping it there. But then for every inch of forward movement, the load of your head on your neck increases by about 10 pounds. So when it gets to around 45 degrees, your neck muscles are supporting the equivalent of up to 50 pounds or 22 kilograms of weight. So as you can imagine, if you then keep your neck in that position for a while, those muscles are going to get tight and painful. The symptoms of Teck Neck are mainly stiffness and pain in the muscles that support the head. So mainly the paraspinal muscles that run up either side of the neck and the upper back, the scapular muscles that connect the neck to the shoulder blades, and the upper trapezius muscles, also known as the coat hanger muscles that run across the back of both shoulders, because these are the main muscle groups that are active in the forwards head position. And it's quite common that the symptoms are worse on one side of the neck rather than the other. This is because we will often adopt a preferred position when the head is slightly tilted or rotated to the left or right, which puts that bit of extra strain on the muscles of one side over the other. And also because it's quite common to lean through one elbow while holding your device or using the computer mouse with the other hand. As such, I tend to see a fairly common picture where right-handed people tend to get more pain on the left side of the neck and shoulder because it's a left arm that right-handed people tend to lean through. Other symptoms can include tension, headaches, and sometimes the pain and occasionally a tingling sensation might travel down the arm if some of the nerves start to become irritated. But the important thing to remember is that Teck Neck in itself isn't usually harmful, but if left untreated, over time it can lead to chronic pain, poor posture and a reduced quality of life. Okay, so let's discuss all of the factors which commonly contribute to someone developing Teck Neck. The average person these days spends about 4 hours a day staring at their phones, and it's nearly always in that hunched posture with the phone down low and the neck hanging forwards. It's quite upsetting really, especially when you see young people in those positions, because you just wonder what their postures are going to end up looking like in their 30s and 40s. Also, in a typical office job, someone might spend 8 hours at their desk, again, essentially just looking at a screen. So it's no wonder that the neck muscles can tighten up and weaken as a result of this, because they are just not being used as nature intended, for movement. So the main causes of Teck Neck are looking at screens and of course looking down in a slouch posture with hunched shoulders in that worst position. But really, even if you're in a perfect posture with the screen directly in front of you, if you don't move out of that position frequently, you're still going to stiffen up. Motion is lotion for our bodies, and if we deprive those neck muscles of motion, they will respond by getting stiffer and weaker. So to summarise, the reason why you might have Teck Neck is often not just about poor posture. It's also about a lack of regular neck movement resulting in weakness and stiffness of the muscles, which often develops over months or years. So if you have developed Teck Neck, then don't beat yourself up. It's simply a reflection of how modern technology has changed the way we live and work. In most cases, it's very treatable and reversible, but it will mean making some changes to your daily habits. Which brings us nicely onto part 3. What can we do about it? Okay, so let's talk about getting this problem better. And the first thing to realise is that you can't avoid technology. It's part of modern life and stitched into our daily routines, but we can change the way that we interact with it. And we do this by focusing on 2 key factors: posture and movement. I'm going to talk about posture first because here we can get some quick wins. Like I mentioned before though, you can sit in the best posture ever, but if you hardly ever move out of that posture, then you're still going to get stiff, weak and painful. It's just that it will take longer to develop. So keeping good posture alone is only half of the battle, but it's still very important when you are interacting with your screen to keep your neck in the most neutral position that you can. So here's 6 tips to help with your neck posture. Number 1, screen height. So make sure the top of your screen is at or just below eye level and is straight in front of you, not tilted over to one side so that you have to twist your neck in order to see it properly. There are so many devices out there to elevate a monitor or a laptop screen, so this is a quick win. Number 2, bring your device to you rather than craning your neck forward. You simply have to get into the habit of holding your phone to your face rather than letting your face sag down to see it. Your arm is adapted to place your hand efficiently in front of your face, for feeding yourself for example, so use it like nature intended. Number 3, the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds. This helps reduce eye strain and helps you to focus on your posture and environment. Number 4, take regular breaks. Stand, stretch and walk every hour, even if it's just for a minute. This is really important, and so I will consider this one bolded and underlined. Number 5, supportive setup. Use a proper desk setup for work, and especially if you work from home. Don't be tempted to work with your laptop on your knee and sat on the couch. Use a separate keyboard and mouse for laptops, and consider using an ergonomic keyboard and mouse if you spend long hours using them. Even better is to use a riser desk, which can move quickly between a sitting position and a standing position. Standing is a so much better position to work in for many different reasons. It's much better for your spinal posture and it keeps you more active and alert. It works your leg and your back muscles and it burns many more calories than sitting. So not only can it help with aches and pains, but it can also help with weight loss and prevent conditions associated with sedentary lifestyles like diabetes. Number 6, mindful awareness. Notice when you're slouching and then try to reset your posture. Try to link a particular moment that occurs frequently throughout your day with your posture. So, for example, every time the phone rings, actively reset your posture. Pick something that happens about every 10 or 20 minutes at your work. It won't take long before the phone rings, you go to correct your posture, and you then realise you're already there. And that's when you've cracked it. And if you are struggling with posture, then you could consider using a posture correction brace, which can just help to remind you when you start to slouch forwards. I'll put links to all the products I talked about in the video description. Okay, so we've gone through posture and the importance of keeping your neck in the most efficient positions. But that's only half the battle. Regular movement is vital in preventing muscle tension and neck stiffness. So I'm now going to show you some basic stretches and exercises which target the movements and the muscles that are most commonly affected in Teck Neck. I'll start by showing you some simple ones that you can do while at work, and then some other more intensive ones that you can do at home, maybe after a stressful day in the office or when your muscles are feeling particularly tight. So let's head to the clinic. Okay, so we're here in the clinic, but before we get started, let's just have a little look at what good compared to bad posture actually looks like. So as I'm sat at my desk here, the position we're trying to avoid is this, isn't it? This sagging down of the shoulders, the forward head position, and generally getting sucked into where the screen is. But it's not just a case, trying to correct this is not just a case of taking the head backwards. That's an unnatural position, and I'm still quite hunched in my shoulders and upper back. Good posture comes from the ground up. So it's really trying to build it from the pelvis and the lower back upwards. So the concentration should be to try and grow tall from the lumbar spine, trying to increase that curvature. Another thing that I sometimes explain to patients is to imagine that they're being pulled upwards from a string attached to the top of their head. As that string pulls them upwards, they are growing tall. And you can see that that straightens up the whole of the spine, and you don't have to think about what the neck's doing. The neck position just sorts itself out once the base of the spine is in a better position. So from this position here, imagine you being pulled upwards from the head, upwards to a nice tall position. Stop when it feels comfortable, and that's a nice neutral posture achieved. And we mentioned before about desk ergonomics, but of course it's just sensible to make sure that your screen is directly in front of you. Top of your screen or near the top is level with your eyes, and directly in front of you, keyboard and mouse are all within easy reach. But like I also mentioned earlier, an even better option is a riser desk. And I spend a lot of my time, probably 60, 70, sometimes even 80% of my working day in this position, because this is far better and far healthier for me in the long term. Okay, so let's get started with the simple exercises that you can do while sat at your desk. And the first one is a straightforward neck rotation. So it's just a case of rotating as far as you can into one direction, holding for about 5 to 10 seconds, and then as far as you can in the opposite direction, and again holding for 5 to 10 seconds. So as a rule, generally when you look over the right shoulder, it's the right sided neck and shoulder muscles you're going to be stretching, and similar over to the left side. Just make sure you do them in a good posture. It's no good doing them in this position because that's unnatural and it's just going to hurt. So get yourself into that upright position that we spoke about earlier, and then rotate. So you can do these in sitting or standing, but just make sure that your posture is good before you start. And the next stretch is the upper trapezius stretch. So this is the muscle that commonly gets really tight at the back of the shoulders, those coat hanger shaped muscles. So we're going to stretch these by leaning over to the side. So basically, as I lean over to my left side with my neck, it's this right side upper trapezius that's going to be stretched. Now, if I just do the activity on its own, naturally, this shoulder is going to rise up and the tension will come off the muscle. So you have to consciously try and keep this shoulder down. Now, one way of doing that is to hook your hand underneath your chair. And then once your shoulder's anchored down, you can then lean away and the shoulder won't rise up, which is the movement you're trying to avoid. So put the stretch on, again, hold for about 5 to 10 seconds and make sure that you do feel a nice tight stretch in the muscle here. Come back to the middle and then repeat for the other side. So left hand underneath the chair and then lean away. Again, 5 to 10 seconds is ideal. And the third exercise are the shoulder blade squeezes. So with these, we're trying to retract our scapulas back, which is the opposite position that we often find ourselves when our shoulders are rounded and hunched at the desk. So with this one, hands down by your side, sit in that nice neutral position, and then try and take your scapulas backwards and squeeze them together. Hold for a few seconds and then relax. So the thought process is to draw the shoulder blades back, squeeze them together, hold for 5 seconds and then relax. And the fourth one are the shoulder blade stretches. So this is the opposite movement to the last one. This time we're going to take our shoulder blades around the chest wall and try and stretch those tight muscles between the shoulder blades. So get yourself into that nice posture again, and then with one hand reach forward as far as you can, and when you think you've gone as far as you can do, just go a little bit further, and that's the bit that then pulls the shoulder blade around. Hold for about 5 to 10 seconds and then release, and then the same on the opposite side. So reach, and then when you think you've gone as far as you can, go a little bit further, count to 5 or 10 and then come back again. 2 or 3 on each side, and then try and do both together. So this time I'm going to sit up nice and tall again, take both hands out. Some people call this the bear hug exercise because you're almost trying to take your arms around something really wide. And once you've got the position as far as you think you can, then go a little bit further, and it's that bit that then pulls the shoulder blade, that extra bit around the chest wall. So reach, and then a bit further, hold for your 5 or 10 seconds, and then release. So that's the shoulder blade protraction stretch. And the final one to do whilst you're at your desk are the thoracic extensions. So this time you can use the back of your chair there as a fulcrum to lean over. This is probably best done with your hands behind your head, and then lean backwards over the back of the chair. Hold for 5 to 10 seconds and then return to starting position. So this basically reverses that forward flex position that we adopt with our thoracic spines. So these 5 basic desk exercises should be done little and often throughout the day. It doesn't matter if you just do 1 or 2 at a time, but at the end of the day, when you add them all up, you might have done even 50 or so of them, but you've just done them in small chunks throughout the day. Okay, so these next stretches I'm going to show you require a bit more time and are a bit more intensive, so they're best done in your own home when you get home from work. Okay, so these next ones I'm going to show you are best done when you're laid flat down on a fairly firm floor. I'm going to demonstrate these on the plinth because I'm not going to lie on the clinic floor today, but this serves a similar purpose. So literally just lying on your back will just give your spine that time to stretch out and reverse the hunch positions that you might have found yourself in all day. And it's just a really simple and easy thing to do. Start with one small pillow, but if you can manage without it, then that's even better. So just lie flat. Let your knees bend up comfortably. And just for some people, just adopting that nice neutral position will be all that's required to feel some relief in your upper back and just a gentle stretch. If you can do without the pillow, then that's even better. And that feels really comfortable for me. And just spending a few minutes, even 5 or 10 minutes in this position can be really helpful. If you feel like you need a bit of an extra stretch, then you can take both arms up, over and backwards, and that'll just help to stretch a little bit more into the upper spine. Maybe hold that position for 10 or 20 seconds, and then return back to normal again. So that's a nice, easy stretch. And your back will really appreciate this position because it's just reversing the postures that it will have been in for most of the day. If you feel like you need to stretch your back even further than that, then you can buy purpose-made spine stretchers, and I'll put some pictures up and a link in the description to the type of thing I'm talking about. So the second part of this exercise, we're going to start stretching our shoulder blades. And what we're going to do is we're going to start with one arm and just reach up to the ceiling as high as we can, hold for a few seconds, and then release back down again. And then the same with the left arm. Reach up high as we can, hold for 5 or 10 seconds, and then back down again. Alternate a few times and then try both together. So as high as you can. Now you don't want to be taking your head up off the pillow here, that's not the idea. The idea is to take your shoulder blades as far around your chest as possible and get your shoulder blades off the floor. 5 or 10 seconds and then back down again. And this will really help to stretch those tight muscles around the scapula and the thoracic spine. Okay, so these next stretches I'm going to show you are for upper spinal rotation. So that's that twisting movement to the left and the right. Now you can do them just as I'm demonstrating now in sitting. Just rotate and pull yourself around a bit further. But I've found that it's more effective to do them in either lying or standing, and so I'll show you those two stretches now. So in lying, over onto your side, both hands together, knees bent and knees together, and rotate your hand all the way out and see if you can touch the floor behind you with your hand, and then come back round again. So it's like an opening the door type exercise, but you're opening your chest right out and then coming back round again. 5 or 10 times is ideal, nice and slowly, holding for 5 or 10 seconds in the end position. And then once you've done your 5 or 10 times on one side, turn to the other side and do exactly the same thing this way. So the way that I do this same exercise in standing is to stand right angles to a wall, just arm's width apart, or a door like I've got now. And then all I'm going to do is take both hands out in front of me, twist, and then fall into the wall, push out and twist round the opposite way. So this is an exercise that not only encourages rotation, but also extension of the upper back and the neck. And it's a really great exercise that you can do quickly and easily. And you could also do this at work. And then swap to the other side. If you think that you can go a little bit further, then rather than being at right angles to the wall, just rotate your feet a little bit more. So imagine that you're on a clock face. So at right angles, my feet are at 3 o'clock or 9 o'clock the other side. And now I'm going to rotate them to around 2 o'clock. So I've now got further to rotate and further to go back. Further to rotate and back around again. Or I could rotate to 1 o'clock. Or 12 o'clock if you're very, very flexible. And the same on the other side. So let's try 11 o'clock on the other side and we'll see how we do. Only just. I think that's about the limit of my spinal movement. So the feet stay where they are, you're pivoting round, stretching, and back again. And the last one I'm going to show you is another spinal mobility exercise that gets your spine into flexion and extension in a nice comfortable position. So I'll do this one in 4-point kneeling. So I've got knees under hips, arms under shoulders, and all I'm going to do is basically round my spine so it's got its maximum amount of curvature. Hold for 5 seconds or so, and then do the opposite movement where I try and curve my spine to its maximum curvature. So it's basically going from one extreme of neck and spinal movement to the other extreme. And this should feel fairly comfortable and fairly easy, but it's just allowing your spine to curve and then reverse and give it that flexibility. Okay, so those are the stretches that I would recommend trying to do after a busy day at work when your back's feeling particularly tight and achy. Well, like I said before, if you try and do them regularly throughout the week as a preventative measure, then hopefully that will mean that you get much less in the way of symptoms going forward on a day-to-day basis. Teck neck is one of the most common problems that I see in clinic, but the good news is that with the right awareness, posture strategies and regular exercises, it's completely manageable. Remember, motion is lotion. Don't just sit and suffer. Take an active role in caring for your neck. If you found this video helpful, then please hit like and consider subscribing to the channel, as it really helps get the video in front of more people who could potentially benefit. And if you've got any questions about Teck neck or any tips that you found helpful for your neck, then drop them in the comments. I'd love to hear from you. Okay, well that's about it for this one. Thanks very much for watching. Take care and bye for now.